My name is Takeshi Yoshimoto, Department of Neurology, National Cerebral and Cardiovascular Center, Suita, Japan. It is a great honor to be able to speak to you today. I'd like to talk about blind exchange with mini pinning technique using Tron FX retriever for M2 occlusion thrombectomy. No disclosure. The BEMP technique, which is a blind catheter exchange techniques and was initially devised using a tolerable 320mm retriever delivery wire to advance the thromboaspiration catheter and the pinning technique with small devices for thrombectomy of intracranial distal occlusions, has been reported to be helpful and safe for optimizing procedural performance when treating MEVO. The Tron stent retriever is a new stent retriever for AIS owing to large intracranial vessel occlusion and MEVO. As the most significant feature, the Tron stent retriever is the only retriever that can be deployed through 0.0165-inch microcatheters, which are the smallest ever manufactured. BEMP using Tron stent retrievers has the potential as an effective and safe treatment for MEVO, including occlusion of the MCA-M2. Here we report the outcomes of the BEMP technique using Tron stent retrievers for MCA-M2 occlusion thrombectomy. Materials and methods. Study design. All AIS patients admitted to our institute within 7 days from symptom onset or last known wear time date was prospectively registered in the NCBC stroke registry. Data for AIS patients with MCA-M2 occlusion undergoing the BEMP technique were collected from March 2019 to June 2020. The Tron stent retriever is a self-expanding stent retriever made of a nickel-tantalum alloy that consists of 2 types of cells with different shapes. The large cell captures the thrombus, and the small cells reduce the stent extension as a fraction. When deploying and retracting from an elongated target vessels, the stent retriever stretches against the friction force and passes through the lesser catheter side of an elongated target vessel. However, the unique cell structure of the Tron stent retriever allows the stent structure to stretch at the bend. Therefore, this stent retriever is less likely to miss a blood clot. The techniques involves deploying a Tron stent retriever through a 0.0165-inch microcatheter, followed by microcatheter removal and blind navigation of a 3-max or 4-max aspiration catheter over the bare Tron delivery wire until the aspiration catheter reaches the clot. A Tron stent retriever is inserted into the aspiration catheter like a cork and put as a unit. Illustrative cases of the blind exchange and mini pinning technique using a Tron stent retriever to remove a clot. A. Lateral angiogram showing an M2 occlusion. B. 0.0165-inch microcatheters in place after deployment. C. The 3-max aspiration catheter is advanced into the face of the clot over the bare retriever delivery wire. D. Final angiogram showing successful reperfusion. E. Mini pinning with corking of the thrombus. BEMP using a Tron stent retriever to retrieve a clot. An illustrative example of the blind exchange and mini pinning technique using a Tron stent retriever to treat a middle cerebral artery M2 occlusions. We routinely place a large bore balloon guide catheter in the cervical internal carotid artery. A. The biaxial system, including the microcatheter and microguide wire, is advanced as a unit, with the microcatheter and guide wire traversing the occluded segment. The Tron stent retrievers is deployed to the clot via a 0.0165-inch microcatheter distal. B. In the next step, the microcatheter is removed from the body. C. A 3 marks or 4 marks aspiration catheter as a distal aspiration catheter is blindly navigated over the bare Tron delivery wire until the aspiration catheter reaches the clot. The Tron stent retriever is pulled into the distal aspiration catheter by placing a bottle of Coke. The pinning clot with the stent retriever and the distal aspiration catheters forms a single unit. The Tron stent retriever and aspiration catheter was subsequently retracted as a unit to retrieve the clot. We assessed the procedural outcomes. First pass ETK score 2C or 3 and 2B 2C 3. Safety outcomes, symptomatic ICH, and clinical outcomes, modified ranking scale 0 to 2 at 90 days, and so on. Results: 18 M2 vessels were treated in 50 patients. 6 female, median age 18 years old, and median NIHSS score 18. The BEMP technique was performed successfully in all cases. Whether to use a 3 marks or a 4 marks catheter was determined by considering one of the following target vessels: dominant, non-dominant, or codominant M2, 3 marks 9, 4 marks 9. The first pass ETIC 2C or 3 and 2B or 2C or 3 rates were 47 and 60% respectively. Symptomatic ICH was not observed. 7 patients archived good outcomes and 1 patient died within 90 days. The cohort clinical characteristic and outcomes in M2 occlusion patients undergoing the BEMP technique. Discussion. Garcia et al. Reported that the BEMP technique using 315mm, 320mm, or 3.528mm stent retrievers led to a higher FPE rates and a lower incidence of SITch compared with mini stent retrievers alone in thrombectomy for intracranial amoebas. In our BEMP technique using 215mm or 420mm Tron stent retrievers, FPE was observed in 47% of the vessels and no symptomatic ICH was seen for MCM occlusion. These results may indicate clinical benefit in BEMP using Tron stent retrievers for MCA M2 occlusion. Limitation. At first, of the small sample size. Second, unmeasured variables could have introduced bias because no formal protocol for device selection was followed. Third, the cost related to using an additional device must be carefully considered. In conclusion, Tron stent retrievers was safely and effectively used in the BEMP technique for acute M2 occlusion and can be combined with a 0.0165-inch microcatheter, which helps treat MEBO in general.